Welcome everyone. It's a pleasure that I'm presenting Dr. Mohammed AlAlfi. Dr. Mohammed AlAlfi is one of the consultant and trainers in Saudi Diploma first and now in Saudi Board of Family Medicine in Al-Qasim Healthcare Cluster. Dr. AlAlfi is also an assistant clinical professor of Family Medicine College of Medicine, Al-Qasim University. And welcome Dr. AlAlfi for our webinar today about counseling and family practice, family medicine practice.
Thank you, Dr. Aisha. Thank you, Vicky, for inviting me to share this webinar with you. Good evening, everybody. Today, inshallah, we will discuss counseling in family medicine. My objective from this presentation, the participant will be able to understand the concept of counseling in family medicine, to know the effective structured counseling strategy developed for use in primary care setting, to learn the counseling skill and why it is important, to learn stages of counseling, to be able to use counseling technique in primary care setting, and I will give outlines as example on smoking cessation counseling, family planning counseling, and HIV patient counseling, to identify the possible barrier in counseling. Introduction. Counseling is an efficient and cost-effective intervention approach in family medicine. Counseling is a process aiming to influence the client to knowledge about their health and health care with a purpose not only to inform but also to change behavior. Counseling patient on lifestyle modification and psychosocial problem is a fundamental competency for family physician. However, a survey found that only between 31 to 56% of primary care physicians rated themselves as having significant experience in counseling about these issues. Brief counseling is effective for many health problems, acceptable to most patients, reducing the need for more time-intensive, costly treatment and referral to specialty care. Definition of counseling. Counseling is a relationship between two persons in which one of them is the counselor, attempt to assist the other, counselee or client. It is specific to the need, issues, and the circumstance of each individual client. Counseling is interactive, mutually respectful, collaborative process, goal-directed, acceptable to social and cultural context. Counseling is essentially a process in which counselor assists the client to make interpretation of fact relating to a choice, plan, or adjustment which need to make. Counseling is a series of directed contact with individual which aim to offer him assistance in changing his attitude and behavior. Indication of counseling in primary care setting. A lot of health problems need counseling in primary health care setting. Approximately 40% of primary care office visits are for chronic diseases or illnesses, in which psychosocial factors play a major role in etiology and disease progression. Counseling patient about health risk behavior is a core component of 18% of all primary care office visits. We had contraception counseling, smoking cessation counseling. All this can be held in primary care setting. Anxiety, marital problem, sexual problem, other relationship problem, and the psychosocial symptom. Reduction of weight in case of obesity. Also, child development and adolescent health, HIV and AIDS counseling, and genetic counseling, especially sickle cell disease and Down syndrome. These are examples of counseling topics in primary care setting. Types of counseling. We had 3 types of counseling. Directive counseling اللي هو بنقول عليها بنطلق عليها counselor centered style. This type is simple to do. Counselor give advice, make decision based on what he think is in the best interest of the client. يعني هنا الكونسلر هو اللي بيدير الحوار واللي بياخد القرار. Expect that the client he will follow his advice. يعني دي like in consultation اللي هو الدكتور centered. Completely directed by the counselor. In non-directive counseling اللي هي الclient centered style. The counselor here is passive, mainly he is listener. Client is the active one, express himself freely and tell the counselor what he wants. After careful reflection and clarification makes his own decision. The main function of the counselor here is to create an atmosphere in which the client can work on his problem. Third type is eclectic counseling, اللي هو selective counseling style. In this approach, neither the counselor or the client controls the session. بيكون interactive. يتم فيه تبادل الأدوار أحيانا. This approach is based on the fact that all individuals are different from one another. The techniques are selective in nature because they have derived from all available methods or style of counseling. This approach is based on the selecting the best and leaving out what is the least required. Here, as I said, neither the counselor nor client control the session. It is a selective counseling approach and highly flexible. Methods of counseling may change from client to client or even within the same client from time to time. Freedom of choice and expression is open to both counselor and client. Communication skills in counseling. Communication skills is the most effective tool during counseling. As we know, majority of our communication are non-verbal, about more than 90%. Non-verbal, body language alone constitutes about 55% of communication. Para language, tone of the voice and the pitch of the voice around 38%. Verbal talk less than 10%, around 7%. Remember, it is not what you say, but always how you say it is important. In non-verbal communication example لها body language, posture, proximity, the distance between the counselor and the counselee, and the sitting in the clinic. You must be empathy. during the counseling session, and this means that you recognize and understand of client's thought and emotion. Body movement is very important, facial expression, eye contact, vocal cues, and appearance and environmental cues اللي هي الارrangement of the clinic أو setting in the clinic. The key skills of counselor: listening attentively, believing in the client, recognize your own limitation, patience, empathy, non-judgmental, stay focused on the topic or problem, and must prepare yourself very well by knowledge. This disease illness model of consultation, I bring it to remember اللي هو client style of counseling اللي هو client centered. Here in the disease illness model, if we remember in consultation, the patient had his own agenda and you must explore it about his problem, and the doctor had his own agenda. And during collection of data, gathering information, there is always parallel search between two agendas. And doctor is concentrate on the disease, symptom, sign, investigation, pathology, and the patient had the illness. The patient is expert in his illness, and he is the one suffer. So you must explore the idea, concern, expectation, feeling, thought, and effect of the problem on the patient. Understanding the patient's unique experience of his problem is very important. So this is a good example of important style to follow during counseling, that you must share your patient or client and to be client-centered. And at the end, integrate the two frame and explain to your patient and let him give option for solution of his problem and reach shared understanding and select the suitable decision for him. He's the one, he select the decision. Stages of counseling. First stage, exploration. The counselor assists the client to explore his thought, feeling, behavior, and situation. By attending, show good attention by asking appropriate question in suitable time. ويكون open-ended question. We ask one question at time to clarify the data about the problem or information from your client. Listen attentively. Speak only to clarify your client's thought. Active listening, providing a mirror of what he is saying or feeling. Focusing, asking for specific example from your patient. You can tell him, I hear you said so and so. What do you mean by this? Can you give me example? Contract, providing a purposeful joint relationship between you and your client. Understand. The counselor assists the client deepen his understanding of himself and the situation by summarizing, bringing idea together. The counselor assists the client to begin to see himself in a new way, The counselor utilizes summarizing skill to help the client to see a broad picture of the problem, logical consequence of what he is saying, identify themes in his thinking or behavior. Third stage, action plan. The counselor assists the client to act on his own understanding of the situation in non-directional manner, non-prescription, and non-making decision on behalf of him. The client may need only support, encouragement, help with decision making, help with problem solving, and to make a contract to continue working on the problem. Help to identify and use his strengths. Here's the steps of counseling. In detail, we had 6 steps. First, define the problem. Define the client expectation from the counseling session. Exploring the action taken by the client and exploring the action that should be taken by the client and getting client commitment, and at the ending of the session. First stage defines the problem. Counselor must be able to build and establish rapport of his client. This is done by create a conducive environment for better flow of the session. Greeting the client at the door with a smile, welcome the client to sit, starting the session with casual conversation. How to define the problem, identify the issues, and create opportunity for the client to explore the issues in depth. Guidelines, ask the client what are the objectives that he wants to achieve by the end of this session. Encourage the client to share. Let the client speak. Don't interrupt him. Defining the expectation of the session, the second stage, the counselor should clarify to the client whether their expectation can be fulfilled or vice versa during the counseling session, and you must structure the counseling session. Inform the client what's the meaning of counseling, the duration of the session, the number needed of the number of session needed, and the role of the client, and inform your client that all what we will discuss and all what we said here is confidential. Exploring the action taken by the client in solving his problem. Use basic skills in counseling. Focus on client behavior. Avoid judging. Avoid conflict. Show interest. Help the client to think new alternative, but don't propose suggestion for him. Exploring the action should be taken by the client. This is a step in which gathered information, the information which you gathered about the client problem is evaluated and analyzed to find the best available solution of the client problem. For decision making, all relevant information is gathered and arranged according to the priority of action, then the effectiveness of information used is analyzed. Appropriate choice of decision and solution are made according to the importance of action. Appropriate choice of decision and solution are discussed with your client to help him to choose the best possible solution suitable for him from the available possibility. The counselor does not impose his decision on the client. Gathering information, getting commitment of the client is in solving his problem is very important. As I said before, the client will choose only one alternative to solve the problem. Why? Because he knows the problem very well. He's the one suffer, and he's the one knows the details of his problem. And this is a chance for the client to engage in decision making. Must give him active role in management of his problem. Follow-up is important in counseling session. The process of counseling is a continuous process. It does not end with counseling session. It proceeds with implementation of plan of action and evaluation of result. After counseling process, counselor should encourage the client as he implements on the action plan that is planned in counseling session. Counselor should make observation on the action of the client and make some changes if necessary to make the plan successful, through which the client can achieve his goals. Last stage is ending the session. The termination stage is the final stage of counseling process, but it is as important as the initial stage of counseling. Counselor discuss the whole process of termination with his client. If the solution is found, then the process is terminated, but it depends on the counselee or client. If he is satisfied with the whole process, he can stop or proceed in future. The counselor summarizes the session. The decision of the client which selected, alternative choice chosen, the client ability to carry out alternative, plan for further action if needed. The client can consult his counselor at any time he wants. This is summary of the primary care counseling strategy. We had different strategy here can be used during counseling, like 5 A's, frames, stages of changes, أو trans-theoretical model, والmotivation interview, والproblem solving, والpass. ال5 A's والframe والstages of changes, all this can be used in health risk behavior, like substance abuse, lifestyle modification, lack of adherence to medication, and medical testing, or any procedure. Also, frame is the same, and stages of changes اللي هي assess the readiness of changes on your client can be used in specific health risk behavior also, substance use, lifestyle modification, smoking cessation, lack of adherence to medication. The motivation interview also applied for specific health risk behavior, substance abuse, lifestyle modification, and the lack of adherence also. Problem solving can be used in any thing that can be formulated as a problem. AlAlfi, they used always in any type of psychosocial problem. دي key recommendation أو الجريد of evidence ال 5A's والفريم ديت is grade B. use of motivational interview grade A. الباس and trans-theoretical stages of changes is grade B level of evidence. Here we will discuss headline of smoking cessation, and here we will use stages of changes. We suppose to assess or ask our client on a smoking cessation during any interview to the patient in primary care. Asked him about smoking. If the patient is a smoker, here we assess the patient nicotine dependence by use modified CAGE questionnaire, or we can use a brief Fagerstrom test. At that time, if you assess the nicotine dependence of your patient and you found that he had nicotine dependence, at that time we will assess the readiness of changes in your patient. If he ready to quit smoking or not, you will ask him. The patient here pass in different stages اللي هي البري contemplation stage اللي هي مرحلة الغفلة. قد تجد إن المريض بتاعك he don't think that smoking is a problem. هو مش شايف التدخين مشكلة بالنسبة له. At that time, you cannot go through quitting of smoking with your patient. You must, at that time, your intervention, give him education about the adverse effect of smoking and introduce ambivalence, inquire about the decision, his decision to continue smoking, express concern, and recommended quitting. Here, you can set for him, today, most of people agree that smoking is not good for health. What do you think? So, at that time, also inform him, I am concerned about your health and believe you should stop smoking. I am wondering how I can help you with this. If the patient is non-smoker, reinforce the patient healthy choice at that time. Contemplation stage اللي هي مرحلة التفكير أو التأمل. The patient think smoking may be problem. After he go back to his home, he can think in your talking with him, and you're afraid about his health and the risk of continuing smoking. So at that time, assess positive and negative. He assess the positive and the negative thinking about smoking, pros and cons. Here you can encourage him and resolving ambivalence. You told him that related the cough, if he had suppose chronic cough or bronchial asthma or any health problem, related it with the risk of smoking and asked him that better to quit, and this symptom will improve if he quit smoking. At that time, when he convinced, he will, this stage, first and second, اللي هي pre-contemplation and complete contemplation stage, can take about 6 months until he convinced. So he will start preparation stage. Preparation stage, at that time, he can convince it and prepare himself and came for you and asked, I will quit smoking. At that time, you must assess your patient and decide when he quit, he must set a date for quitting. And this date must be within 2 weeks maximum from this visit, and start to think if he had nicotine dependence and need some drugs to help him for quitting, like nicotine replacement or non-nicotine, like bupropion or Shambix. You will decide at that time what is the next with this patient. Also, you can help this patient to send him to smoking cessation clinic to provide him with this medication if needed. Action stage, the patient quits smoking. Intervention, begin nicotine replacement therapy if needed, or bupropion or Shambix if needed. Physician and staff maintain frequent contact with the patient to provide support and help provide solution for dealing with specific triggers situation. Maintenance stage, the patient remain off smoking and quitting. Intervention at that time, continue positive reinforcement of healthy choice. If there is relapse happen, review what happened and reassess readiness for changes and enter appropriate stage. Identify reason of relapse and to consider how things might be done better. Physician support another attempt when the patient is ready to work with the patient to develop a more effective smoking cessation plan. This is the 5 A's also can be applied with smoking, the same cessation or drinking alcohol also. The family planning stage of counseling and family planning, can we put it in abbreviation GATHER? First, greet client in friendly, helpful, and respectful manner. Ask client about the need, concern, and the previous use of any contraception method. Tell the client about different option and the method available. Help the client to make decision about choice of a method she prefer. Explain to the client how to use the method and arrange for follow-up, return schedule, and carry out return visit for follow-up to the client. First stage, greet, welcome, and register your client. Prepare chart and record. Determine the purpose of the visit. Give client full attention. Assure your client that all information discussed will be confidential. Counseling has to be done in suitable environment. There should not be any kind of disturbance and interruption. Ask the client about her need. Write down the client age, marital status, number of previous pregnancy and birth, number of living children, if she lactating or not, basic medical history, previous use of family planning method, and the history and the risk of sexually transmitted disease or pelvic inflammatory disease. Explores a client idea, concern, and expectation about family planning. Ask the client if there is a particular method she is interested in. Discuss any client concern about risk versus benefit of modern contraception method, dispel remorse and misconception. Tell the client about the available contraception method. Focus on the method that most interested to the client, but briefly mention other available contraceptive method. Describe how each contraceptive method works, the advantage, benefit, possible side effect, and disadvantage of each method. Answer the client concern and question. Help the client explain to the patient the information needed to help her to make informed choice of the appropriate contraceptive method. Effectiveness of each method, بتعتمد على effectiveness of each method, risk and benefit of various methods, advantage and disadvantage, the best method for specific cases, instruction for their use, and the follow-up policy of various contraceptive methods. Repeat this information if necessary. Explain any procedure or lab test needed to be performed. Explain how to use the method, how, when, and where. Explain to the client how and when she should get resupplies of the method if necessary. Return the follow-up visit. At the follow-up visit or return visit, ask the client if she is still using the method. If the answer is yes, ask her if she is experiencing any problem or side effect, and answer her question and solve any problem if possible. If the answer is no, ask her why she stopped using the method, and counsel her to see if she would like to try another method or retry the same method again. Make sure she is using the method correctly. Ask her how she is using it. Counseling for HIV patient outlines. Establish rapport of your client, introduce yourself, good eye contact, proper use of body language, show empathy. Counseling has to be done in suitable environment with no interruption. Acknowledge your shortcomings and emotional difficulties in this session. Ask the patient about the current history, any complaint of time being. Use open-ended question. Explore the patient idea, concern, and expectation. If the patient doesn't know about his condition, break the bad news gently and gradually. Encourage the patient to express his feeling. Take brief history, current and past history. Assess the patient understanding what he knows about his disease. Explain to him what is HIV infection, mode of transmission, available treatment, types, mechanism of action, side effect, what is the stages of the disease and the prognosis of the disease, how can the patient protect his family from infection, what precaution needed to stop spread of infection to others, respond to the patient question, attentive listening, summarization and feedback is very important. Set an action plan with your patient, referral to the hospital to starting treatment plan, shared follow-up care with the hospital, give health education material handout, give the patient telephone number to call in emergency, arrange follow-up appointment, be aware of medical legal rule and regulation and the ethical consideration of such situation, and the nice ending of counseling session. Sometimes Pretest counseling guidelines is needed. The patient should be in position to make an informed decision about whether or not to have the test. The patient should be provided with all information about the test. The physician should prepare the patient for positive or negative result. The patient should be informed his or her legal right and the physician ethical obligation. The patient should be told the advantage of having the test. A relationship between the physician and the patient should be established based on trust, confidentiality, and the continuity of care, giving the patient the opportunity to ask questions. Post-test counseling guideline. You must assure from the test result. Check the patient understanding of the result, allow expression of feeling, identify the patient immediate concern, educate the patient on implication of disclosure of the result, assess any risk of body harm, identify source of support other than physician, discuss possible future difficulties, encourage the patient to ask a question, encourage healthy lifestyle, infection control measure must be taken in consideration, arrange for follow-up. Barrier of counseling in clinical practice, in noise, one of the most important things, interruption, assumption and misconception, language difference between the client and the counselor, poor listening skills, distraction and interruption, personal barrier, lack of training, focus only on advice or making decision for the client, personal limitation, organizational barrier, lack of time, pressure of work. Conclusion: counseling is a process and not only technique through which the client are helped to modify their behavior and cope with their status effectively. Sequence of steps put in this abbreviation: gather, greet, ask, tell, help, explain, return, or follow up. And the key element in counseling: client centered, listening, interactive, exploration, non-judgmental, and trust. Counseling, remember, counseling is not telling or directing, not giving advice, not a casual concern, not a confession. Thanks for your attention and any question.
Thank you so much, Dr. Mohammed, for this comprehensive lecture. And actually, counseling is very important in all life. This is very important topic, especially as a family physician. We need to master it, and we use it daily in our practice. If there is any question, just you can add it in the chat or. طبعا smoking, which is the part which Dr. Mohammed highlighted, is something which is really very important. This is one of the main risk factors that we are having now, and counseling about smoking cessation is a must. And I went through a study which showed that we as a family physician, we sometimes feel we don't ask the patient frequently about the smoking, and we have to start to do this and start to initiate any counseling with the patient is ready about the smoking. If there is no questions now, is there any questions in the chat? It's thank you. Everyone is saying thank you, Dr. Mohammed. And
thank you, Dr. Aisha. I am very happy to be with you today.
Yeah, it's my pleasure, Dr. Mohammed. And just you and Dr. Abdulaziz and all the Al-Qasim Academy, I would like to thank you all. And in behalf of all the attendees of this session, thank you. Vicky, if you have any comments.
Thank you, Vicky.
I'm good. Thank you, Dr. Mohammed. Thank you, Dr. Aisha, and thank you, everybody.
Okay, see you then in next webinar. كل عام وانتم بخير. الشهر مبارك علينا وعلى الجميع مقدما. الله يبلغنا وياكم هذا الشهر ويعيننا وياكم على صيام وقيام. نلقاكم بخير. Good evening, everyone.
Thank you, Dr. Thank you.
Bye.
Assalamu alaikum.